Welcome to EMTprep Pulse Check, the podcast where we help you sharpen your knowledge, ace your exams, and stay field ready. Whether you're prepping for the NREMT or looking to stay sharp in the ever-evolving world of EMS, we've got you covered. Each episode brings educational insights, real-world case reviews, and expert tips to boost your confidence, both in the classroom and on the call. Let's jump in. In today's episode, we're going to be covering 50 critical care questions that review a variety of areas on the ISBC's critical care, flight paramedic, and critical flight nurse curriculums. Let's get started.
First question. HACE, or high altitude cerebral edema, generally occurs at altitudes above blank feet, and onset is within blank of the patient's arrival at altitude. Options for answers include 12,000 and hours, 10,000 and minutes, 8,000 and hours, or 12,000 and days. The correct answer is 12,000 and within hours of the patient's arrival. HACE appears to be a combination of sustained cerebral vasodilation, increased capillary permeability across the blood-brain barrier, and the inability to compensate for excess cerebral edema. HACE generally occurs at altitudes above 12,000 feet, and onset is within hours of arrival at altitude. With any reported illness that occurs at altitude, symptoms are presumed to be caused by the change in altitude until proven otherwise. Next question. In a severely hypothermic patient, what unique finding may be present on an EKG? Options include hyperacute T waves, Osborne waves, De Winters T waves, or peaked T waves. The correct answer is Osborne waves. Osborne waves are a positive deflection at the J point. They may appear on the ECGs of hypothermic patients, most commonly those with a core body temperature of 30 degrees Celsius or less. Osborne waves are not highly specific to hypothermia and may also be observed in other conditions, such as hypercalcemia or Brugada syndrome. Next question. The blank toxidrome is associated with symptoms including hypertension, tachycardia, diaphoresis, agitation, and hyperthermia. Possible answers are sympathomimetic toxidrome, opioid toxidrome, anticholinergic toxidrome, or sedative hypnotic toxidrome. The correct answer is sympathomimetic toxidrome. With an increased response of the sympathetic nervous system, sympathomimetics may cause the symptoms listed in this question in addition to seizures, tremors, pupil dilation, and paranoia. Drugs like cocaine, methamphetamines, or other amphetamines may cause symptoms in this toxidrome. Treatment should include managing the agitation and hyperthermia with supportive care, benzodiazepines, and, if applicable, managing hypertensive crisis. Next question. Overproduction of the hormone cortisol over a period of time can lead to what disorder? Possible answers include diabetes insipidus, Graves' disease, Addison's syndrome, or Cushing's syndrome. The correct answer is Cushing's syndrome. Addison's disease is the result of inadequate cortisol production by the adrenals. Graves' disease is a condition of hyperthyroidism, and diabetes insipidus is a condition of inadequate production of or response to ADH. However, Cushing's syndrome has to do with a chronic overproduction of cortisol. Next question. A Blakemore tube is primarily used in the management of which of the following conditions? Options include liver cirrhosis, respiratory failure, aortic abdominal aneurysm, or esophageal varices. The correct answer is esophageal varices. A Blakemore tube is used to tamponade an esophageal varices bleed. To work properly, it must also maintain tension after placement. Next question. Bright red blood in the stool most often indicates bleeding in which part of the gastrointestinal system? Options include esophagus, stomach, small intestine, or large intestine. The correct answer is large intestine. Bright red blood in stools suggests a lower GI bleed, often originating from the large intestine. Next question. You are called to the home of a 98-year-old female. The family states they cannot wake her this morning, which is concerning because she tripped over a rug and fell yesterday, but said she was okay and wanted to stay home. The patient's GCS is 7, blood pressure 207 over 113, a heart rate of 54, respirations are regular, cosmals, and her left pupil is larger than her right. You intubate the patient on scene and begin transport. Which of the following interventions would be most appropriate? Options include administer tranexamic acid, administer midazolam and fentanyl, 500 ml bolus of LR, or hyperventilate to end tidal CO2 target of 20 to 25 millimeters of mercury. The correct answer is administer midazolam and fentanyl. Midazolam and fentanyl for sedation are appropriate and vital to prevent coughing, bucking the tube, or otherwise resisting mechanical ventilation, as this can increase ICP. Mild hyperventilation to an end tidal CO2 target of 30 to 35 millimeters of mercury may be appropriate, but 20 to 25 millimeters of mercury is too low. A hypertonic solution would be more appropriate measure to reduce this patient's ICP. Tranexamic acid is indicated for isolated head injuries like this patient's, but must be given within an hour of the initial injury. Since this patient went to sleep and woke up with symptoms in the morning, TXA is not indicated. Next question. Which of the following is incorrect about 23.4% saline administration? Options include central line is preferred route of administration, IO administration is contraindicated, administer 30 ml bolus over 10 minutes, or rapid administration may lead to heart failure. The correct answer is IO administration is contraindicated. While a central line is preferred, IO administration is typically the second line option, and recent evidence has shown that administration via well-functioning peripheral IV lines is also safe. Next question. You arrive at an ER for an interfacility transfer of an already intubated patient. While completing your assessment before loading the patient on your stretcher, you notice the patient is having muscle spasms and is tachycardic, hyperthermic, and tachypnic. The nurse tells you that the patient was intubated using succinylcholine and rocuronium about 2 hours before your arrival. Based on this information, which of the following should you have a high index of suspicion about? Options include serotonin syndrome, neuroleptic malignant syndrome, malignant hyperthermia, or sympathomimetic syndrome. The correct answer is malignant hyperthermia. Malignant hyperthermia can occur up to 12 hours following the administration of succinylcholine. It is characterized by muscle spasms, profound muscle rigidity, acidosis, hyperthermia, tachycardia, tachypnea, rhabdomyolysis, and hyperkalemia. Next question. Which type of acute kidney injury is caused by hypovolemia? Options include pre-renal, intrarenal, post-renal, or non-renal. The correct answer is pre-renal. Pre-renal acute kidney injury is due to decreased blood flow to the kidneys, often caused by hypovolemia. Next question. You respond to a call where a 25-year-old woman at 32 weeks gestation has been involved in a minor car accident. She reports feeling some contractions and mild abdominal discomfort but no bleeding. What is your primary concern? Options include placenta previa, fetal distress, preterm labor, or ectopic pregnancy. The correct answer is preterm labor. Given the gestational age and symptoms, the primary concern is preterm labor, which can be triggered by trauma. Next question. How does progesterone influence the respiratory system during pregnancy? Options include by decreasing tidal volume, by increasing respiratory rate and tidal volume, by reducing lung capacity, or by inhibiting respiratory function. The correct answer is by increasing respiratory rate and tidal volume. Progesterone acts as a respiratory stimulant, increasing both the respiratory rate and tidal volume to meet the heightened oxygen demands during pregnancy. Next question. You respond to a call for a 30-year-old woman at 35 weeks gestation who has fallen down the stairs. She reports abdominal pain, and you note visible bruising on her abdomen. Based on this information, your index of suspicion should be raised for all of the following except options include uterine rupture, spontaneous abortion, placental abruption, or fetal distress. The correct answer is spontaneous abortion. Spontaneous abortion is the abrupt loss of a pregnancy before 20 weeks gestation. Blunt trauma places the patient at risk for the remainder of the answer options. Next question. Which symptom is most indicative of abruptio placentae in a pregnant woman? Options include painless bright red vaginal bleeding, severe abdominal pain and back pain, high fever and chills, or frequent urination. The correct answer is severe abdominal pain and back pain. Abruptio placentae often presents with severe abdominal and back pain due to the premature separation of the placenta from the uterine wall. It is also often associated with vaginal bleeding. Next question. What physiological change in the cardiovascular system is most significant during pregnancy? Options include decrease in blood volume, decrease in cardiac output, increase in blood pressure, or increase in cardiac output. The correct answer is increase in cardiac output. During pregnancy, cardiac output increases significantly to meet the heightened demands of the growing fetus and the mother's body. Next question. In pediatrics, a bulging fontanelle most likely indicates which of the following? Options include congenital defect, abdominal injury, elevated ICP, or thoracic edema. The correct answer is elevated ICP. Bulging fontanelles are most often a sign of increased or elevated ICP. Numerous medical and traumatic conditions can cause this, including encephalopathy, meningitis, head injury, brain tumor, and hypertension. Next question. In pediatric patients, a transient event with no clear cause that may include a combination of apnea, color change, muscle tone change, and or choking/gagging in an infant would be defined as. Options include SIDS, ARDS, pediatric syncope syndrome, or BRU. The correct answer is BRU. BRU, or brief resolved unexplained event, is a real condition that can occur in pediatrics when a sudden, brief, resolved event occurs that is often accompanied by the symptoms stated in the question. It is always recommended that patients seek evaluation at the emergency department regardless if symptoms have resolved. Next question. You are working in an emergency room assisting nurses when a 21-year-old woman at 10 weeks gestation comes into the ED with severe nausea and vomiting, dehydration, and weight loss of 5 kilograms over the past 2 weeks. What is the most appropriate initial treatment? Options include administering IV fluids and antiemetics, encouraging her to drink Gatorade, emergency ultrasound, or starting a high-protein diet. The correct answer is administering IV fluids and antiemetics. The patient likely has hyperemesis gravidarum, which requires IV fluids and antiemetics to manage severe dehydration and nausea. Next question. Which hormone is primarily responsible for maintaining the thickened uterine lining during pregnancy? Options include estrogen, progesterone, oxytocin, or prolactin. The correct answer is progesterone. Progesterone helps maintain the uterine lining, ensuring a suitable environment for implantation and fetal development throughout pregnancy. Next question. You respond to a breathing complaint of an 11-month-old male with respiratory distress. On approach, you note stridor, drooling, tachypnea, and increased work of breathing. His parents tell you he had a sudden high fever this evening. Based on the following, what condition would be most likely to occur? Options include epiglottitis, croup, foreign body airway obstruction, or ARDS. The correct answer is epiglottitis. Sudden high fever, drooling, and stridor would most likely be related to epiglottitis. Croup can result in stridor in severe causes. However, it most often presents with a low-grade fever, symptoms of a common cold, or upper respiratory symptoms such as runny nose, nasal congestion, and cough, and patients are less likely to be in severe distress. Drooling also can be a sign of significant upper airway swelling, in this case due to inflammation of the epiglottis. Next question. The presence of a high respiratory rate alarm on a ventilator would most likely be caused by options include decrease in FiO2, increased lung compliance, increase in patient discomfort or anxiety, or decreased VT. The correct answer is increase in patient discomfort or anxiety. A high respiratory rate alarm would be triggered by the respiratory rate increasing over the set parameters for the ventilator. Changes to respiratory rate could be due to patient discomfort, painful response, dyspnea, anxiety, changes to patient condition. Decreased VT and FiO2 would not directly relate to an increase in respiratory rate, as well as improved lung compliance would more likely lead to a decrease in respiratory rate and improved comfort with breathing. Next question. You are treating a 71-year-old patient suffering from shortness of breath secondary to chronic bronchitis. His end-tidal CO2 waveform shows a prolonged phase 2, and his end-tidal CO2 levels are slowly beginning to rise and no longer return to zero during inhalation. Which of the following would most likely be occurring with this patient? Options include acute respiratory distress syndrome, or ARDS, pneumothorax, bronchoconstriction with air trapping, or CHF exacerbation with air trapping. The correct answer is bronchoconstriction with air trapping. COPD and asthma patients during bronchoconstrictive events often suffer from air trapping. This results in prolonged exhalation, which can be seen with a prolonged phase 2 on end-tidal CO2 waveforms. Because of the constriction within the bronchioles, this causes decreased emptying of the alveoli, and ultimately the lungs are not completely emptied with each exhalation phase. This prolonged phase 2 can cause patients to develop shark fin appearing waveforms, as well as waveform levels not returning to zero upon inhalation, which will slowly begin to increase. Next question. You are treating a 28-year-old male patient who has respiratory failure secondary to status asthmaticus. He was intubated before your arrival, and the ventilator settings are set as follows: volume-controlled ventilation, tidal volume, 475 milliliters, rate, 12 breaths per minute, FiO2, 100%, PEEP, 5 centimeters H2O. To prevent further barotrauma from occurring while ensuring adequate ventilation, you should. Options include switch to pressure-controlled ventilation, increase PEEP to 10 centimeters H2O, increase respiratory rate to 20 breaths per minute, or increase tidal volume to 600 milliliters. The correct answer is switch to pressure-controlled ventilation. Switching to pressure-controlled ventilation can reduce the risk of barotrauma for asthmatic patients by controlling peak airway pressures. Increasing PEEP, respiratory rate, or tidal volume can potentially increase the risk of barotrauma, especially in an asthmatic patient. Next question. What are non-depolarizing neuromuscular blocking agents primarily used for in RSI? Options include preventing the depolarization of cells involved in muscular contraction, promoting the depolarization of cells involved in muscular contraction, mitigating the risk of bronchospasm in intubated patients, or mitigating the risk of vasospasm in intubated patients. The correct answer is preventing the depolarization of cells involved in muscular contraction. Non-depolarizing neuromuscular blocking agents are primarily used to prevent the depolarization of cells involved in muscular contraction to induce paralysis and aid in successful intubation. Next question. A fast and deep respiratory pattern without any periods of apnea is known as which of the following? Options include Kussmaul breathing, Biot's respirations, Cheyne-Stokes breathing, or tachypnea. The correct answer is Kussmaul breathing. Kussmaul breathing is labored with periods of deep breaths and often associated with metabolic acidosis. Next question. Which of the following lab tests would be most beneficial in predicting if your patient is at an increased risk of pulmonary embolism? Options include BMP, CBC, troponin, or D-dimer. The correct answer is D-dimer. While routine blood tests may help explain why the patient is forming blood clots, a D-dimer test, which detects a protein found in the blood from dissolved clots, is most helpful in predicting things like DVT and PE. Next question. A 55-year-old patient presents with progressive dyspnea and dry cough. High-resolution CT shows diffuse ground glass opacities. What is the most likely diagnosis? Options include COPD, pneumonia, pulmonary fibrosis, or pulmonary embolism. The correct answer is pulmonary fibrosis. An appearance of ground glass on a CT highly indicates pulmonary fibrosis. The patient's symptoms support this differential diagnosis. Next question. Changing the IE ratio from 1 to 1 to 1 to 3 would result in which of the following for a patient with emphysema? Options include allow for more thorough exhalation, reducing the likelihood of dangerous air trapping, allow for less exhalation, reducing the likelihood of dangerous air trapping, allow for more thorough exhalation, increasing the likelihood of dangerous air trapping, or allow for less thorough exhalation, increasing the likelihood of dangerous air trapping. The correct answer is allow for more thorough exhalation, reducing the likelihood of dangerous air trapping. COPD and asthma are diseases at the highest risk for air trapping and auto-PEEP. Because of this, increasing expiratory time is vital to allow for sufficient release of CO2. An inspiratory to expiratory ratio, or IE, of 1 to 6 or 1 to 8 is not uncommon in patients with obstructive lung disease. Next question. You believe your patient's ventilator circuit is disconnected or leaking. Which vent alarm are you most likely getting? Options include high pressure alarm, low pressure alarm, apnea alarm, or low minute volume alarm. The correct answer is low pressure alarm. Low pressure alarms occur when the resistance to inspiratory flow is lower than the preset alarm. Next question. Which of the following ABG values indicate respiratory failure in an intubated patient? Options include a pH of 7.3, a PaCO2 of 50, a PaO2 of 65, a pH of 7.15, PaCO2 of 35, or a PaO2 of 55, a pH of 7.25, a PaCO2 of 45, or a PaO2 of 70, or lastly, a pH of 7.17, a PaCO2 of 35, and a PaO2 of 80. The correct answer is a pH of 7.15, a PaCO2 of 35, and a PaO2 of 55. An ABG indicative of respiratory failure would be a very low pH, very high CO2, and a very low PaO2. Next question. Central venous pressure, or CVP, monitoring is primarily used to assess blank. Options include right atrial pressure, left atrial pressure, systemic vascular resistance, or none of the above. The correct answer is right atrial pressure. CVP is specifically used to measure the pressure in the central venous system, particularly in the major vessels of the venous system, i.e. the vena cava, which reflects the right atrial pressure as blood enters the right atrium from the vena cava. Due to its location for pressure monitoring, CVP is not utilized for nor capable of measuring the other options. Next question. A Swan-Ganz catheter can be used in the critical care setting for monitoring blank. Options include right ventricular pressure, pulmonary artery pressure, central venous pressure, or all of the above. The correct answer is all of the above. A pulmonary artery catheter, a Swan-Ganz or right heart catheter, is used to assess all of the above. It is inserted into the pulmonary artery to monitor the heart's functional capacity and overall blood flow. Next question. Which of the following medications does not increase the risk of internal bleeding? Options include nitroglycerin, clopidogrel, heparin, or Activase. The correct answer is nitroglycerin. Nitroglycerin does not increase the risk of bleeding as it is a vasodilator. The other medications listed are considered anticoagulants or fibrinolytics. Next question. Decreased right atrial pressure may indicate which of the following conditions? Options include hypovolemia, hypervolemia, cardiac tamponade, or right ventricular failure. The correct answer is hypovolemia. Decreased right atrial pressure would indicate hypovolemia. Hypervolemia, cardiac tamponade, and right ventricular failure would be indicated in increased right atrial pressure. Next question. When inspecting an ECG for left axis deviation, which of the following findings would indicate left axis deviation? Options include a positive QRS in lead 3 and a negative QRS in lead 2, a negative QRS in lead 3 and a negative QRS in lead 2, a positive QRS in lead 3 and a positive QRS in lead 2, or a negative QRS in lead 1 and a positive QRS in lead 2. The correct answer is a negative QRS in lead 3 and a negative QRS in lead 2. Left axis deviation can be diagnosed if the QRS is negative in leads 2 and 3. Right axis deviation can be diagnosed if the QRS is negative in lead 1. Next question. Which of the following conditions can mimic the presentation of an ST segment elevation myocardial infarction, or STEMI, on an ECG but does not involve coronary artery occlusion? Options include pericarditis, atrial fibrillation, aortic stenosis, or mitral valve prolapse. The correct answer is pericarditis. Pericarditis can cause diffuse ST segment elevation across multiple ECG leads, which can mimic the appearance of STEMI. Next question. Pulmonary capillary wedge pressure, or PCWP, typically reflects the blank. Options include left atrial pressure, right atrial pressure, pulmonary artery systolic pressure, or none of the above. The correct answer is left atrial pressure. PCWP is primarily used to estimate left atrial pressure via a Swan-Ganz catheter. It can provide crucial feedback on how the left side of the heart is functioning and help further diagnose left-sided heart failure, fluid overload, and mitral valve function. Next question. During transport, you note pulsus alternans on your monitor. What is this indicative of? Options include severe left ventricular failure, right-sided MI, tension pneumothorax, or aortic aneurysm. The correct answer is severe left ventricular failure. Pulsus alternans is a sign of severe left ventricular failure. It is defined as beats that alternate between strong and weak. Next question. Your critical care team is dispatched to an interfacility transport for a patient with an aortic dissection. The sending doctor believes the patient is having a DeBakey type 3 aortic dissection. Where in the aorta would the dissection be located? Options include originating and confined to the descending aorta, originating and confined to the ascending aorta, originating in the ascending aorta and involving the aortic arch, or originating in aortic arch and proximal to the left subclavian artery. The correct answer is originating and confined to the descending aorta. DeBakey's classification of an aortic dissection is divided into 3 types. Type 3 originates in and is confined to the descending aorta, but is distal to the left subclavian artery. Type 1 originates in the ascending aorta and involves the aortic arch and descending aorta. Type 2 is confined to the ascending aorta. Next question. A patient with a known history of left ventricular hypertrophy, or LVH, presents with chest pain and ST segment elevation in the lateral leads. What additional ECG feature would help differentiate LVH as a STEMI mimicker? Options are tall R waves in the precordial leads, deep S waves in the anterior leads, T wave inversion in the lateral leads, or absence of reciprocal changes in the inferior leads. The correct answer is tall R waves in the precordial leads. LVH can cause ST segment elevation in the lateral leads due to the strain pattern. Tall R waves in the precordial leads and the absence of reciprocal changes help differentiate LVH from a true STEMI. Next question. Gray-Turner sign suggests that blank is occurring. Options include GI hemorrhage, cystitis, pancreatic hemorrhage, or appendicitis. The correct answer is pancreatic hemorrhage. Bruising or discoloration to the flank region refers to Gray-Turner sign. This is due to subcutaneous hemorrhage in the retroperitoneal space and commonly occurs secondary to pancreatic hemorrhage or retroperitoneal trauma. Cystitis or bladder inflammation and appendicitis, appendix inflammation, do not present with this flank ecchymosis, and GI hemorrhage is likely to present with either blood in feces or emesis. Next question. Which of the following must be continually assessed when administering blood products to ensure patient safety? Options include signs/symptoms of transfusion reactions, blood clot development with a non-filtered blood administration set, signs/symptoms of infection development, or hypothermia. The correct answer is signs/symptoms of transfusion reactions. Transfusion reactions can present with fever, chills, rashes, dyspnea, and others. Blood products should always be administered with a filter to ensure patient safety throughout care. Infections from blood product administration are unlikely, and symptoms of infection development will take time to develop and likely will not be witnessed during the EMS setting. Lastly, while blood products are often stored in a refrigerator, they are warmed to body temperature before administration, so hypothermia would not likely occur. Next question. A 21-year-old male arrives at the ER via ambulance with a stab wound to his chest. He is hypotensive and tachycardic with JVD and muffled heart tones. Of the following, your index of suspicion should be raised for which life-threatening condition? Options are hemothorax, tension pneumothorax, major vessel laceration, or cardiac tamponade? The correct answer is cardiac tamponade. Key symptoms of cardiac tamponade include muffled heart tones, JVD, and other signs of shock. This patient likely has a penetrating cardiac injury that is causing blood to leak into the pericardium and now obstructing the heart's function. If a major vessel was lacerated, the patient likely would have symptoms of hypovolemic shock, so JVD likely would not be present, nor would muffled heart tones. A tension pneumothorax or hemothorax both may have JVD, although they likely would not have muffled heart tones. Next question. Which medication may be administered to enhance urine flow and prevent myoglobin-induced renal damage in rhabdomyolysis? Options include N-acetylcysteine, allopurinol, mannitol, or sodium bicarbonate. The correct answer is mannitol. Mannitol is an osmotic diuretic with a rapid onset of action. Next question. Your patient is a 35-year-old male who is a diesel mechanic and suffered severe burns when a hydraulic line caught fire. Both arms are badly burned in what appears to be partial to full thickness burns. Which of the following sets of signs and symptoms are characteristic of a common complication associated with severe burns? Options include polyuria, polydipsia, and polyphagia, hemorrhage, heat loss, and hypertension, pain, pallor, and paresthesia, or hypotension, hypoglycemia, and hypokalemia. The correct answer is pain, pallor, and paresthesia. Deep partial thickness burns and circumferential burns are known to cause compartment syndrome, a severe complication of burns, amongst other conditions. Compartment syndrome is a condition of tissue damage that leads to swelling and tissue damage, necessitating surgical intervention to relieve pressure. The 5 Ps are commonly associated with compartment syndrome and consist of pallor, pain, paresthesia, paralysis, and pulselessness. Next question. Which sign is indicative of a pelvic fracture and involves bruising over the perineum, scrotum, or labia? Options include Cullen's sign, Gray-Turner sign, Battle's sign, or Distat's sign. The correct answer is Distat's sign. Distat's sign is indicative of a pelvic fracture and involves bruising over the perineum, scrotum, or labia. This sign suggests the presence of a significant pelvic injury and internal bleeding. Cullen's sign and Gray-Turner sign are related to intra-abdominal bleeding, while Battle's sign indicates a basilar skull fracture. Next question. In the context of trauma, what does the term cavitation refer to? Options include the formation of a cavity in the skin due to a penetrating injury, the temporary cavity formed by the pressure wave of a high-velocity projectile, the permanent wound track left by a bullet, or the collapse of a lung following rib fractures. The correct answer is the temporary cavity formed by the pressure wave of a high-velocity projectile. Cavitation refers to the temporary cavity formed by the pressure wave generated by a high-velocity projectile, like a bullet. This can cause extensive tissue damage around the projectile's path, not just along the direct wound track. Next question. A patient presents with 10 out of 10 neck pain, as well as decreased motor function in her legs. She was the restrained driver in a high-speed rear-end style MVA. She has a GCS score of 15, denies loss of consciousness, and has bruising over her chest consistent with a seatbelt restraint. Of the following, what most likely would be the cause of injury based on the information provided? Options include deceleration trauma, thermal trauma, blunt trauma, or penetrating trauma. The correct answer is deceleration trauma. Rear end style MVAs can be a commonly caused type of deceleration trauma where the body undergoes a rapid stop, resulting in internal shearing forces. This may cause neck pain and decreased motor function. There is no specific reason to believe penetrating nor thermal trauma is present, and blunt trauma is not as likely with the symptoms. Next question. You arrive at a local school event on your critical care unit. The patient is a 57-year-old male who had a sudden syncopal event approximately 5 to 10 minutes prior. On arrival, his coworkers tell you that he fell about 8 feet off a ladder and immediately lost consciousness. After regaining consciousness, he developed a severe headache accompanied by nausea, vomiting, decreased mental status, and double vision. At this point, his coworkers called 911 and reported that since he had been awake, he had not been acting normally. Of the following, what is the most likely type of intracranial hemorrhage? Options include subarachnoid hemorrhage, epidural hematoma, subdural hemorrhage, or intracerebral hemorrhage. The correct answer is subarachnoid hemorrhage. Symptoms of a subarachnoid hemorrhage include a sudden, severe headache described as the worst headache of their life. They are often accompanied by nausea and vomiting, light sensitivity, double vision, stiff neck, altered mental status, seizures, and coma. Patients often will decline rapidly as they are commonly caused by ruptured aneurysms. While an epidural hematoma may also present with a brief period of unconsciousness, the severe headache is characteristic of a subarachnoid hemorrhage. Last question. Which clinical finding is suggestive of a significant hemothorax requiring immediate intervention? Options include increased discomfort on the affected side, clear fluid upon chest tube insertion, chest pain exacerbated by deep breathing, or dullness to percussion on the affected side. The correct answer is dullness to percussion on the affected side. Dullness to percussion indicates the presence of fluid, blood, in the pleural space, suggesting a significant hemothorax that requires drainage.
Thanks for tuning in to EMTprep Pulse Check. If you found today's episode helpful, be sure to subscribe, leave a review, and share it with your classmates and crew. For more test prep tools, study guides, and practice exams, head over to EMTprep.com. Until next time, stay sharp, stay safe, and stay on pulse.